Hello. Thank you for clicking on this link. This is Healthcare Conversations. Today's guest is Alicia Scavona.
Alicia Scavona is the Vice President of Supply Chain at Beaumont Health in Michigan. Alicia has an educational background of a Master's in Supply Chain Management from Michigan State, a Bachelor of Science in Business Logistics and International Business from Penn State, and significant work experience in supply chain as Director of Continuous Improvement for Trinity Health. A Director of Logistics for Lurie Children's in Chicago, a Logistics Manager for Mayo Clinic, and experience on the vendor side as a Director of Supply Chain for Medline. Whether in the boardroom or the warehouse, Alicia's training and experience brings operational excellence to any project. Beaumont Health is Michigan's largest healthcare system and provides patients with compassionate, extraordinary care no matter where they live. With 8 hospitals, 155 outpatient locations, nearly 5,000 physicians, and 33,000 employees, Beaumont's commitment to patient and family-centered care contributes to the health and well-being of residents throughout the community and beyond.
Well, Alicia, thanks very much again for your time today. And before we get into some conversation, I want to take a second and maybe give a little history and a little background. I often describe myself as like an old hospital guy, which usually communicates a level of been there, seen that, and was burned by that experience. When I first met you some years ago, you were at Lurie Children's in Chicago. And it may have taken a minute or two, maybe 3 minutes. But my impression was you were one of the most direct, unfiltered, and been there, seen that supply chain members that I'd met. I think some of the best healthcare workers are those people who frankly have been burned from those experiences and get up every day with 100% effort to achieve the highest quality, and hitting the bumps in the road, shows what it could be if the bumps were smoothed out. So, maybe just take a second is like, how did you get to be that, been there, seen that, have the t-shirt so early in your career?
So that's a great question. And the way you just described me, I'm like, yep, that's pretty much how I show up every day. I think a lot of it has to do with early in my career, I got exposed in manufacturing to lean, and I kind of got addicted to that ability to do process improvement and use our people who do the work every day to really make that leap from what are we doing right now to where could we possibly go. And that's probably one thing between process improvement and then backing it up to support the case with the data that's driven me throughout my career. So you'll see, my whole career, I call it as turnkey operation. Like, I'm addicted to going to places that need help, fixing it and leaving with a really good, strong model with good, strong people, and then going on to the next organization.
So did you just announce that you're leaving Beaumont? Do they know that?
I did not, but we'll talk about it. There is a letter of intent that was recently signed with Spectrum, so West Michigan. So there is a possible merger, which just means more opportunity.
Sure. Well, maybe to build on what you just said, because I was going to do this a little bit later, but it sort of follows what you just said. But I guess I might put you on the spot a little bit. But in a prep call that we had before this, you talked about the daily challenges that a supply chain organization has. And you're certainly dependent on an incredibly complex ecosystem of vendors, technology, trucks, workers, spikes in activity, unforeseen events. God knows what rolled into the emergency room. And you mentioned that in a lot of days you wake up with, a feeling of, who do you have to kill today? And so could you talk maybe a second about what are your expectations for your vendors, for your supply chain team, and even for your internal customers?
Right. So I think I said, is anybody going to die? No, are we going to kill today? We don't say that in healthcare. And so that's the priority matrix that I've probably been operating off of for the past 10 years, right? Because you always, especially in operations, have a list of projects you're trying to accomplish, and then the unexpected fires that are popping up. And literally my brain goes, okay, so when I was at Larry Children's, I had parking. And I used to go, well, nobody's going to die. So like, we're not going to do that one right now, but I am going to go after the fact that a suction rate increased and we have to secure more suctioning so our PARs aren't, adequate. So that's where I really picked it up. But right now with the suppliers, I think the biggest thing is partnership. So what we've missed a lot in healthcare is an us versus them mentality. Instead of, you want to know my data, you want to know what my operation is, you want to know what my strategy is, here's what it is. But not every supplier for me gets that level of cooperation, right? So it's, who do I see that like I want to grow with and develop, and who really impacts my business on the day-to-day? And then how are we going to help each other? So I'm a big proponent of doing blended, Kaizen activities with those vendors, whether it's operational improvement that is going to be a cost savings, or just both of us are going to have some more operational efficiencies. So on the operations side, I always start to get to know my distributor. And I started asking the question is, I know I'm not perfect. So what are we doing to you that's causing a lot of headache? And then what can we do to fix that, right? And a little bit motivating too, because once I'm helping you fix yours, then I'm going to come and ask you to change some of your operations to suit mine, or ask you to come see my operation and show, these changes we need to do. So definitely that's on the supplier side, is the more partnering and the more understanding who's my suppliers and who am I trying to grow with in the future. The second one on the supply chain is, I think sometimes we get put into our silos, or people get put into, if I'm in sourcing, and not to pick on sourcing, but like I have a goal, my goal is to hit X amount of dollar of savings. But as they're hitting that savings, are they thinking about the operational impact they're going to have? And I would always say not always, right? They're targeted on a goal. So we haven't really thought of always the cause and effect relationship of what we're doing over here, how it trickles down.
Right.
And so I think that's a huge opportunity right now in healthcare. And I also think that just with the recent pandemic, one of the things we really need to be doing is, and I'm in Detroit, but learning from the automotive industry, or even our medical device industry. They don't just say like, oh, I'm getting this part from Bob. They actually do component risk models. They do supplier risk models. They're actually evaluating these relationships and then trying to grow with them. And it's not just on, did I get a great deal today? But it's also on what else is that supplier and what else is that component bringing, forward. And I think really within supply chain, we need to have those cross-functional conversations, and we don't always show up like that. And we don't show up like that at the hospital together, right? And I'm going, well, it wasn't my fault. It was value analysis. I didn't do that. I'm just saving them again, or what have you. Then our customers lose faith that we have ourselves put together, just like we would as patient, right? Like if I'm giving you a lot of information about my health, and then the next person comes in, then I'm kind of wondering like, what's my patient care experience going to be here, right? So I think it's the same way. It ends up trickling down to our customer base within the hospital. Like, do they have faith in supply chain? So that's probably why I get excited, one, about staying in healthcare, but two, when I talked about turnkey operations. So How do we start changing the face of healthcare? And how do I show up to a nurse and say, you know what I want you to do? I want you to go back to the bedside and take care of that patient to the best of your ability, because that's what you were trained to do. And I was trained to figure out your min-max levels, because there's a science behind it, and because, this is what I do here. So how do I show up and, take back what I call take back our profession? So that's kind of where my head constantly is how do we elevate ourselves to our customers?
No, that's interesting. I mean, it's a real theme that I've been bumping into lately, that strategic sourcing perspective, where there may actually be a gap between the two pillars of supply chain, right? So like you said, you've got a very financial oriented organization and a very operational oriented organization, but downstream, what does the nurse care about, right? She wants the highest quality product and she wants it on the shelf. And so
Right.
she's actually the connection point between the two pillars of supply chain. And so it is strategic and it is operational.
Right. Absolutely.
Hmm. You mentioned COVID. Like, how is your health system? Where are you at right now with COVID? Are you coming out of it? What did you learn from it? Did you have to go to a virtual workforce? Did you have the PPE scramble that everybody had? And what about the impacts to the community that you serve?
So I don't think I shared this with you, but I started this role as VP at Beaumont March 15th, 2020.
Oh,
I actually got a text to say, do you want to come to work a day early, and showed up on a Sunday. And the big change for me was I walked into an organization where I don't know my team. I don't know, the leadership team. I really, I was joking. I'm like, I don't even know where the bathroom is. And here we are in this like huge pandemic. And, I've got to take this and make rapid fire decisions.
right.
So like all health systems across the United States, March and April were a real, trial and tribulation. We fortunately we're self-distribution. So we didn't have a problem storing the items when the PPE came in and cross-docking, since we also have our own transportation fleet. So we operate actually 53-foot trailers with Class A drivers. But we still struggled on securing the PPE like everybody else did. Right. And then we did receive it, doing an evaluation to say, can I send this down the line? Right. Because we do so many quality checks generally up front, but even our subs of a sub of a sub was not available, and everybody was under a scramble. For me, I joke and say, like, whatever the plan was for my 30, 60, 90 onboarding, I liked this plan better. I immediately got to know all my staff. I constantly was overly direct and used to say to them, I don't have time for words, so this is what we're going to do. Right. And just let's rapid fire, get this work done. And then I actually worked on the floor. Like, I helped build the pallets and things like that because, well, one, we were strapped on resources. So it was hard to hire. You don't want to bring people into your environment and then have them possibly expose, your staff and employees. But for me, it was a great way to get to know folks. We then ended up building some projection models, and they weren't too bad based on the data that we had. We actually started collecting a lot of data. It put us in a great place this summer. We were well prepared for the predicted fall surge. And then we had another surge that was pretty significant here in Michigan this spring. So I'm happy to say that there was no reactive behavior in November and April. And we're going through and now talking about, maybe our projection model was a little bit high on ear loops. How are we going to run through because of expiry and dated materials? So for me, COVID was this weird, odd blessing on how do you connect with a team within 30 days because you have to. And then how do you also, kind of push out hey, I remember this from Ebola, swine flu, bird flu. Let's not make the same mistakes. Let's get some data prepared. Let's get our government plan ready. And they're like, what are you talking about? We're just trying to get some disinfectant.
Yeah.
So yeah, I mean, I don't want another one, but here we are.
No, well, I mean, that's trial by fire, but I'm getting right into the foxhole with everybody's, like you said, shortens the honeymoon period.
Very short.
Yeah. I know you've mentioned before, we've talked a couple of times, analytics and data-driven analytics and decision-making based on data is a really big thing for you. And again, coming off of the pandemic, some of the health systems and leaders I've been talking with, blocking and tackling has just become kind of, the big focus again in restoring from COVID, but also just looking forward to, like you said, we don't want this to happen again. And so what is your perspective on analytics for an event like that, but also just from the PAR locations daily, from all the things that happen, from spikes in activity to nurse behavior, hoarding, putting things in drawers, calling down for things that are there, but they don't look. just things like that. What is your perspective on how to take a data-driven approach towards supply chain management?
So yeah, so I'm a bit like self-proclaimed data nerd. I still ask for only raw data, and you can do some of the analytics, but I just want the raw data in the back to poke and prod, double check things. I think one of the things is the difference in the pandemic was the unknown, right? So where I talked about, we had a production model, and it was based off of all our inputs that we had. But what we didn't factor in necessarily is that the protocols changed, right? And that as we're like handing out 1 million face shields, all of a sudden the protocol for face shield changes, and an ear changes, and an N95, so like it was a little bit more flexible. So just recently during this last April pandemic, I said, let's put the other projection model away. It's already garbage. It's only a year old. Let's redo it with this new data, because now we know how we would operate, what we're doing. And this data, right, because it's closer to the present time, is going to be more reflective and accurate. And that's why we came back, because now maybe I don't need, 14 million ear loops to get me through 90 days. Because, now we're around like needing maybe 6 million. So let's figure out how to use up, right? So I think that's very different. But folks have asked me, like, can you forecast in supply or in healthcare? I'm like, not really. I actually had somebody say, well, like if it rains, which is raining today, you're going to have more ER visits. And I was like, and a very smart person, I'm like, wait, so every time it rains, you go to the ER? Well, don't you have more car accidents? I don't know. Do you smash your car every time? There's not all these correlations that we can necessarily pull out, right? And we know we have to
stay away from that person.
Right. I was like, no, we don't. Like, there's other things we know about. There's flu seasons, there's respiratory seasons, intakes and surgery due to vacation. There are things we know, but there's not that kind of correlation that, maybe a candy company has, and they're like, hey, I bet you people are going to buy stuff around Easter and Halloween. Like, of course we are. So really the data-driven analytics in the floor stock areas, I'm a big proponent of pulling it back, but then taking and using the appropriate modeling exercise. So the appropriate economic order quantities, right? And starting to build from that foundation and using the safety stock model, even though, you talk about Z values and stuff and people are like, what? Because that data is more accurate. What disturbs me in healthcare is we walk around and say we need 3 to 6 days of inventory and that everything shows up in 5 to 7 days. But what we don't measure is lead time, right? We don't actually measure, like, did this widget show up in the 7 days? Because if my widget doesn't show up for 15 days, well, then that's why we're expediting. And their 3 to 6 day model is absolutely incorrect every day if it takes 15 days to get from the supplier. So it's starting to pull that data back and really get into the details instead of using, these 3 to 6, 5 to 7 days that we've arbitrarily done. So we'll pull those models back. And as we pull those models in, they have to be robust that you can refresh them. And one of the biggest proponents that I've been pushing, since owning the operations is also, when do you go to nursing and talk, and when do you not go to nursing? So I don't go to nursing to ask about, can I change your min-max level, right? I don't go to that unless the data says, wow, this is really off. You went up or you went down, and we need to go have a conversation. So now my conversation is, hey, I noticed your suction tubing. Man, you guys, like, you were trending like this, and then boom, you went up. What happened? Did you have a patient up there? And then they'll be like, oh yeah, little Johnny was here and we had to do a suction rate of 50. Oh, cool. So I don't need to count, this data. It's not what's happening. In other conversations you have, they're like, oh yeah, we changed protocol. And I was like, okay, cool. Like, I'm over here. Can you guys tell me next time? Like, how do we partner better? I don't mind you change protocol, but I also want to make sure you have the stuff, right, that you need so that we increase your stock on hand. Same thing with if we're going to remove an item off the shelf. We should be saying like, hey, notice you're not using this anymore, or volumes, trickle down. Can you tell me the story? And I usually ask for the story behind the item, not the permission. I feel like as supply chain professionals, we will know whether we can move something up or down, but we still need to understand, was there like a patient, impact? And then,
Right.
the biggest thing you just asked is, I'm not that great at customer service. I don't pretend to be. And I think I shared with you before that I don't want you calling. If you're calling me, that means we have a mistake or we have an issue. Like if you're not calling me, like your world's great and you got everything you need and we delivered on time and like everything's perfect. So if you're calling me, I want to make sure that you're calling me for something that you need. So I think the story that my favorite one is, we would get a call down Children's for diapers. Perfect. But then we would walk it. The thing I told my team is go to the supply closet, because if the supply closet's out, you're going to get 45 more calls. You don't want 45 more calls. So just take it and grab based on our protocols, the amount of inventory you need to take up, fill the room, and then take it to the nurse and do the room delivery and let her know that, the supply closet's now filled. However, if you get to the supply closet, you notice that it's completely filled, take the product and let the nurse know that she can find it in the supply closet. Because we need them to use the product up there. We can't be going up and down, every day because they like hand delivery. So it's just been a change in partnering with nursing, right? So that's kind of where I am in on that theory. Like use the data to start the conversations, but don't use the data to gain permission.
So a couple of things, and this might get too into the weeds, but I'm curious. So I think you highlighted what I consider to be just one of the most difficult things in supply chain and healthcare, which it's sometimes called predictive analytics, but it's really visibility into usage. And I often say that, like the guy that runs the 7-Eleven down the street knows more about his demand signal than, an entire supply chain organization in a healthcare. And it's because you're far away from the actual usage. You're not connected to it. And so you have to look at the demand pull that happens in the supply room. But so that's one thing. But the second thing, the other challenge around that, and like you say, there's all types of different formulas on the market to figure out par, right? And and everybody's got their own little flavor. I agree with you on lead time. That's got to be factored. Safety stack, average daily use, all of that. Pretty much the Toyota model. But then you hit the wall of the actual physical space. So if the math tells you need 500 of these things in there, and you've got a tiny little cubicle, right, or if you put 500 there, it displaces everything else. Then you're also chasing that demand signal. So 2 points: if you don't have visibility into usage, you really are reactive. And if you don't have the physical space, you're always chasing it as well.
Right. So I hear you on the physical space. I always walk into those supply closets and then go like, how else could we rearrange this? What else could we do? And then you have to come back and say, you know what, I just can't hold that many urinals or suction caps or what have you. But I haven't met a supply closet yet that doesn't need some of the items removed. So that's generally what I go after. Or, we're putting this big old bin in here and it holds like IV clips. And we need to right size our bin and stuff like that. After that, though, then I need to figure out, like, do I need to visit that floor twice just to check on, the items that have dwindled down? Or I use nursing all the time, like, hey, listen, I just need to know like what couple items you guys are low on and that need to replenish. And then my team can come up and do a little twirl and make sure the rest of them are good. But at least give me like the starter of what you're looking for. I also think that sometimes when they run out, it's based on an acuity or a type of care that we're doing. And I would rather just take some supplies direct to the room. If it's, for something like in particular. And then my last point would be, I've been starting to, instead of just delivering to the floor stock, I keep asking, so where does this stuff go after I deliver it? Because what do you always find, right? You open up cabinets and
Right.
okay, so you have no tubes, blood tubes, but they're all here. And you have gloves, but they're all here. So do you want me just to deliver there, or can we talk about why you moved that? Because my supply closet's 40 Fitbit steps away.
Right.
Or you put it on this cart and now you're doing bed server. So why denture cups need to go in there? Like, because this is a little bit more of the value I think we can bring back. Because I won't stock denture cups in your floor stock room. Let me just stock your little bed server cup or instead, right? We all win. You don't have to do this extra movement. You've got the product there. And then my demand signals, to your point, are actually more reflective of where it's being used.
Yeah. Yeah. Understanding the point of care. Yeah.
Right.
I wanted to ask you a little bit about Beaumont. I mean, it's Michigan's largest health system with 8 hospitals, I believe.
Right.
As you're looking at your world within that, do you have long-term goals across the entire enterprise? How are you optimizing that entire ecosystem? And you'd mentioned a couple things like maybe there's strategic sourcing opportunities, technology, or enterprise-wide process improvement initiatives.
So a couple things. So Beaumont is 8 hospital systems, but it's still based off of multiple mergers. So one of the standard improvements is just starting to come back and have all the hospitals from a supply chain standpoint operate in the same way. So we see the boxes the same, order, stock, storeroom, things like that. And why that's also extremely important is we also, like I mentioned, our self-distribution with our own transportation fleet. And we not only service those 8 hospitals, but we service 150 non-acute locations as well. So some of the big strategic initiatives for us is reevaluating and looking at our distribution center and asking, who were we over the last 7 years? Who are we right now? And who do we want to be in the future? And what does that do in correlation with, like I said, partnering with our current suppliers? And then what does that do to our service model? So that's really a lot of where we are. And then on the transportation side, we have a great benefit with having our own fleet because not only do we do deliveries to the hospitals, but again, we manage the whole continuum of care. So we're in non-acute, but we haven't applied much technology to it. So we got a lot of drivers who've been with us for 15 to 25 years. And my biggest fear is they're going to call one day and be like, hey, love working here, but I want to retire, right? And I'm at the age that I can retire, and me and my wife, we got a place up north. So we're starting to add a lot of applications to, I keep calling it like, would UPS do this? Would Penske do this? Right? I don't need the best technology out there, but I need some more data, shocking, to pull back and really validate what we do every day, how much product because we move 10 different categories. So I'm not just moving supplies. I got cash bags, pharmacy, linen. I mean, we've got a whole plethora of stuff on those trucks. So that's really where we're going after in our technology realm as well. And then strategic sourcing, it's still a matter of a big focus right now on purchase services. Which to me is fun because that's probably the category that is the least focused on, but probably has some of the best opportunity. And as they're focusing on purchase services, we're also making sure to build up a diversity program. So again, when I kick back and look at manufacturing, it's like we're behind the 8 ball in healthcare, but I also think that's what makes it a little bit exciting because we can't just pull out, let's say, the Ford diversity program and apply it in healthcare because there's there's a bit of education that we need to do with our suppliers, with our leadership about, what this program brings back to the hospital and who we are in the community and who we serve.
Wow. It's a lot on your plate. So I don't think you'll be leaving there anytime soon. We've only got a few minutes left, and I guess I just wanted to end it. It obviously doesn't matter. You're talking about diversity. It obviously doesn't matter that you're a woman in healthcare, but there really aren't as many women in supply chain. Are there any particular challenges that you face, or do you have any advice for other women that may want to pursue supply chain management?
Yeah, so I think the for me, there aren't a lot of women in supply chain operations. So I typically end up sitting at the table by myself. And I jokingly said like, oh, I didn't even know I was a girl until you pointed it out. I was, and I'll just share quickly. So I came from a family where my mom fixed everything that was broken. My dad wasn't allowed to use her tools. And as we were building on to our house, she was in the contractor's face, like telling him, you know, what to do and how to do it. And then my dad.
Why am I not surprised?
Right. And that was, you know, my childhood. I was like, well, that's what you tell people. And then my dad has some of the softest hands. He's a CPA and he can grow the most beautiful roses. So I think growing up in that household, it was never a matter of this is my role and this is what I do. It was more about, you know, just go out there and then, you know, insert yourself in the world. Right. So I will say too, like supply chain, I feel like it's growing. It's starting to encourage women to come on the operation side, right? Like, hey, I think all women want to organize things and sort things and do 5S activities, and we're really great at it. Like we put together fabulous outfits. That's all I'm doing in a storeroom. Consistently thinking about efficiencies, but it's just not the part of supply chain that has been, you know, represented necessarily to girls. So that's what I've been working recently with more universities, and they all go, oh, I want to go into purchasing and sourcing, and I'll start up with, well, what about operations? It's super fun. You know, so I don't know, like, I think it's also just personality, right? Yeah. Like you started off this, it's like, you're very direct. You're very, yep. So, it really helps. And then at the same point, like with my teams and stuff, it's different, right? I'm very like concerned about what's going on. How do we feel about this? What are we doing? So, yeah, more women in supply chain would be great.
Well, we've gone a little bit over, so I think that's maybe a great place to close it out. And I just wanted to thank you for your time. Like I said, I think you're an interesting person in the industry, and I appreciate this time that you spent.
Yeah, absolutely. I appreciate seeing you again as well.
Thanks a lot, Alicia.
Thanks, Dan.
Bye. Take care.